Thomas Starzl, a transplant surgeon at the forefront of liver transplant surgery in the 1960s and who was a leading researcher into anti-rejection drugs, died March 4 at his home in Pittsburgh. He was 90. The University of Pittsburgh, where he had long been on the medical school faculty, confirmed the death but did not cite a cause. Dr. Starzl performed the world's first liver transplant in 1963 and the world's first successful liver transplant in 1967, and he pioneered kidney transplantation from cadavers. He later perfected the process by using identical twins and, eventually, other blood relatives as donors. Since Dr. Starzl's first successful liver transplant, thousands of lives have been saved by similar operations. Dr. Starzl joined the University of Pittsburgh Medical School in 1981 as professor of surgery, where his studies on the anti-rejection drug cyclosporin transformed transplantation from an experimental procedure into one that gave patients a hope that they could survive an otherwise fatal organ failure. Dr. Starzl's development of cyclosporin in combination with steroids offered a solution to organ rejection. Until 1991, he served as Chief of Transplant Services at UPMC, then was named Director of the University of Pittsburgh Transplantation Institute, where he continued research on a process he called chimerism, based on a 1992 paper he wrote on the theory that new organs and old bodies learn to coexist without immunosuppression drugs. The institute was renamed in Dr. Starzl's honor in 1996, and he continued as its director. Dr. Starzl's career-long interest in research began with a liver operation he assisted while a resident at Johns Hopkins Hospital in Baltimore. After the surgery to redirect blood flow around the liver, he noticed the patient's sugar diabetes also had improved. Thinking he had found the cause of diabetes to be in the liver rather than the pancreas, he designed experiments in 1956 with dogs to prove his discovery. He was wrong, but he had started on the path that would lead to the first human liver transplants at the University of Colorado in Denver. In the early 1990s, livers from baboons were transplanted into humans, an operation made possible by Dr. Starzl's research into alternatives to scarce human livers. While work continues on such animal-to-human transplants, most researchers now focus on pigs rather than primates and use genetic engineering to try to knock out some proteins most involved in causing acute rejection, said Abhinav Humar, clinical director of the Thomas E. Starzl Transplantation Institute. Dr. Starzl's other accomplishments included inventing the way to route the blood supply around the liver during surgery to make possible the marathon hours required to complete operations involving that complex organ. He also showed that soldier cells from the transplanted organ become missionary cells that travel throughout the new body and find new homes, apparently helping the body accept the foreign organ. Dr. Starzl helped develop with John Funk, his protege at UPMC and successor as Director of Transplant Surgery, the use of the experimental anti-rejection drug FK506, which paved the way to more complicated transplants of multiple organs, including the difficult small intestine. FK506 was discovered in a soil sample by Japanese researchers. In September 1990, at age 65, Dr. Starzl put away his scalpel for good, soon after the death of a famous young patient, a 14-year-old girl from White Settlement, Texas, named Stormy Jones. Stormy lived 6 years after a combination heart liver transplant at age 8 but needed a second liver in 1990 and died within 9 months. Her death affected Dr. Starzl greatly. It is true that transplant surgeons saved patients, but the patients rescued us in turn and gave meaning to what we did, or tried to, he once wrote. Thomas Earl Starzl was born in Le Mars, Iowa, on March 11, 1926. His mother was a nurse, and his father was a science fiction writer and the publisher of the local newspaper. Dr. Starzl was a 1947 graduate of Westminster College in Fulton, Mo. He received a medical degree and a doctorate in neurophysiology in 1952 from Northwestern University. He wrote a memoir, The Puzzle People, published in 1992. He was a past president of the Transplantation Society and the American Society of Transplant Surgeons, and his awards included the National Medal of Science in 2004 and the Lasker DeBakey Clinical Medical Research Award in 2012. His first marriage, to Barbara Brothers, ended in divorce. Survivors include his wife of 36 years, the former Joy Conger, a son from his first marriage, Timothy, and a grandson. 2 children from his first marriage, Rebecca and Thomas, died before him.